What are the problems in aging? We have to deal with a high increasing number of elderly in the next 50 years and going hand with more hypertension, more diabetes, more strength decrease. And this has to be dealt with the whole society and the costs coming with that. What is the solution for that? We can do physical activity. With the benefits of physical activity, we have a reduction in many disorders and as well as diabetes, hypertension, cancer, decreasing stress, anxiety, depression, and delaying of several other effects proposing. What is the WHO proposing? So I think everybody knows that at least 150 minutes per week, moderate or 75 minutes vigorous intensity, and beside that muscle strengthening. So for older adults above 65, the recommendation is to do as most as possible and be active every day in at least 30 minutes to have benefits from physical activity. How is the situation in Europe? The Eurostat and P8 fact sheets of the WHO saying that 50% of the population is sedentary and doing nothing, and only about 14% is, if you can sum up, 14, 16, 30% of the population is doing more than 2.5 hours a week. How is the situation in Bratislava and Austria? If the physical activity fact sheets are fine, 12% only of the adult population is physical active enough, and in Austria, in the older adults, 24% only. So what was the idea? We had a lot of experience in different projects in the past, and so we decided to move from our last project, Mobility in Aging, to a more broader approach and to bring physical activity to seniors in Austria and Slovakia. So we implemented the project Center of Active Aging with our partner, the Faculty of Physical Education and Sports at the Comenius University in Bratislava. And we moved to our institute in St. Pölten, the physical and drama therapy. What are the main effects? We get a lot of money, more than 3 million euro, lasting the project till the end of February 22. Our main goal is the population of 60 to 80-year-old seniors and to increase the level of physical activity in this population. How to achieve this is done by a construction of a new building. So the majority of the budget is going to a new construction in Slovakia to provide there a special facility for the new training approaches. Besides that, we want to implement an activity and prevention program and also try this program and bring it to about 1,000 subjects in the program area. So how does the activity program look like? It's a 12-week training program, 2 times a week, 50 minutes each session, with a personalized strength training once a week and alternating gymnastic, land, or aquatic. It's done in Austria in small groups, 3 to 5 people. And in Bratislava, where the facility is bigger, we can go up to 10 people. Before and after that, we have 3 hours of education in exercise and nutrition. And we do a big fitness check assessment at the beginning and the end, lasting about 2 hours. We started also to implement an education group only because not all seniors are near enough to come to the facility and to the institutes to follow up the program for 3 months. And as you know, most of the seniors who are retired are very, very active and have a lot of program and the calendars full. So they can try the education only, and if they like it, maybe start in the next weeks also the training program. What is the test battery in the program? We measure weight, height, BMI, all the standard parameters, bioimpedance measurement, asking a question about nutrition. We have the questionnaires about general physical health, ECO5D, short form 12. Also the physical activity questionnaire, the general physical activity questionnaire. And in function, we have, like in the past, hand grip, knee extension torque, the senior fitness test containing a lot of different functional tests. These are Few pictures of the training groups in the beginning of this year, 2020. You can see gymnastics, cycling, and water gymnastics. We started quite happy in the beginning of 2020, but then suddenly Corona stopped all activities. So our seniors, what about 80 seniors running in the project,
Io scelgo qua. No, no.
To the question, Hugo?
Hugo, mute your microphone, please.
We had a problem to stop all activities, but now started again in July. So what is the situation in Bratislava? They started up the building in July 2020. You see on the right side the situation right now in November. And it's planned to...
Sorry, this is the reason why we have such a big budget. For this big budget is for a new building in the university in Bratislava. Not for research, but for the building in Bratislava, okay? Only to make some... Thank you. Go ahead.
So just a few preliminary results of the first subject finishing from October on. So we have a quite healthy population. As you can see in the EP5 and SF12, we are in the normal range, slightly increasing the numbers, not significantly, because we only have 20 subjects. This is hand grip and knee torque in kilogram and Newton meter. It looks like a little bit better or no change. If you have a look on the gender specific differences, we have already significant changes in the female group on the right side. What about nutrition waist circumferences? Also here, we have already, with a small number of subjects, which is quite interesting, significant changes, not visible, but statistically, maybe not clinically relevant, also in the female group. Interestingly, in the nutritional index, it's a calculation after the bioimpedance measurement, we have an increase to normal values in the male population. If you have a look at the functional tests on the left side, chair rise test, increasing in repetitions. We have 30-second arm curl test, increasing in repetition above the normal value in this population. We have the time up and go test, significant decrease in time needed. We have the 2-minute step test, increase in repetitions significantly. We have the 10-meter normal walking velocity in normal speed and fast speed, also increasing in both significantly. So what are the next steps? We are starting a cross-sectional study with a lot of parameters, also including biopsy, blood, and saliva samples, which was planned in April 2020, but has to be postponed now till November, and maybe hopefully we can start, or maybe Milan can say a few words afterwards. How is the situation with the governmental restrictions? It's not so easy at the moment. Okay, this was the short introduction about center of active aging and the current situation. We're looking forward to Christmas. There's a nice picture from St. Pölten. In the better times, we will see what happens this year and how it looks like. So I think questions will be postponed afterwards in the discussion.